Well, just last week, the Food and Drug Administration met for 2 days to decide if warning labels on pain reliever products containing naproxen could be altered.
A study seemed to suggest that naproxen might be safer to take than other pain relievers, but the FDA voted 16-9 against the conclusion that naproxen has a lower risk of heart attack and stroke than similar anti-inflammatory medications.
Here to help us sort through all this information is Dr. Maria Palafox from the Brevity Clinic for Surgical Care. Doctor, thanks for joining us this morning.
Joining us.
Good to have you. Well, let's talk about some of the risks that are involved with taking pain relievers, first of all.
It depends a little bit on what pain reliever you're talking about. In general, pain relievers should be used for short-term use. And so you wonder, well, what's the definition of short-term use? As a general surgeon, I prescribe a lot of pain medication, specifically narcotic pain medication. And I think 2 to 4 weeks on pain medication, as long as you're using less and less, is probably reasonable use. Here what you all are talking about is anti-inflammatory medication, which is a little bit different because it doesn't have a narcotic effect.
Okay.
And specifically with non-steroidal anti-inflammatory medications, it has a lot of GI side effects. In this study, they're talking about the cardiovascular side effects as well.
Yeah.
So that whole aspirin a day keeps the doctor away. You know, sometimes you heard that people need an aspirin for certain things, but that can have other risks, I guess, for your body, right?
Right, it can. It can make you more prone to bleeding. A lot of people who take aspirin every day notice they bruise a lot. But also aspirin has effects on the lining of the stomach, so to speak. So patients who take aspirin every day can be a little bit more prone to something like a GI bleed, stomach ulcers, or at least gastritis. And that's true for non-steroidals as well.
Yeah, I'm sure you should never decide on your own to take an aspirin a day or a pain reliever a day, especially if it's over the counter. You should probably check with the doctor first, right?
I think you should because it may interact with other medications.
medications.
Sure, yeah, absolutely.
What if you're taking aspirin and ibuprofen 3 times a day and you're not taking anything for stomach ulcers?
Yeah.
You might end up having severe gastritis.
Or if you have a blood
definitely.
thinner and you're taking those, that could cause probably some damage as well.
Potentially.
Yeah,
All right.
definitely.
Okay, what about, tell us the difference then. We have Aleve, we have Tylenol, aspirin, ibuprofen, we hear all these. What is the difference and how do they affect our bodies differently?
Well, aspirin, for example, the difference in all of these is their mechanism of action. And so some of the side effects that they cause specifically are on the digestive tract. For example, naproxen is kind of your standard anti-inflammatory drug. The way that it causes side effects, it affects the mucus that lines the stomach. And so the forces that counteract all the gastric acid in our stomach are kind of downplayed. And so then you have more GI effects. Naproxen is similar to ibuprofen. They're in the same category. Aspirin has a little bit different mechanism. It knocks out platelets, and so that's the way it gives us our nice blood thinning capabilities that are cardioprotective, that affect our heart. Tylenol is really more an antipyretic, meaning it's really just good for fever. It has some properties that help with pain, but generally, I don't know if you've noticed this, but if I take Tylenol for a headache, it doesn't work. So I take ibuprofen.
Yeah, you take something different for each pain. It
Right.
seems like,
It's really more for reducing fever. That's what antipyretic means.
Okay. So is there a safest one? If you have to give one to your child, would you say that there's one that's safer than the others or not really?
Well, I guess I think personally to avoid GI effects, probably Tylenol is
Right.
safest. But again, it really does
Depends
have
on the
somewhat
handling.
limited
Yeah, sure.
use. Right,
Absolutely.
exactly.
Gotcha.
But in this study, they were comparing, what they did was they did a meta-analysis, and so that means they compared a whole bunch of studies. The limitation of a meta-analysis is that all of these studies are done differently. One group is a group of 50-year-old women that take naproxen.
Yeah.
Another group is men who take Palafox and naproxen for knee pain. Another one is a group that knows that they're taking the medication, but they're also taking Pepcid, let's say.
Yeah.
So they're all kind of different studies. And so you're trying to compare things that theoretically you
Right.
can't really compare
apples to
because they're
oranges.
completely different.
Exactly, yeah.
And so there are some limitations to it. But the reason a meta-analysis is done is to just try to gather as much information, although they're from slightly different sources, to be able to provide information.
Yeah.
And so they think that naproxen may be a bit safer for the heart compared to others, but I do think you have to take it with a grain of salt because they have
Sure.
not been strictly compared, you know, in the same situation to see if that's true.
Yeah, and as always with any medication, even over the counter, talk with your doctor first and decide
Right.
what's best for whatever ails you. I mean, it could be something different for each
Right.
thing.
It may be
so.
something you don't think.
Exactly.
Even herbal
Even some
supplements,
natural,
actually.
yeah, there are some
True.
natural alternatives out there too. Okay.
All right.
Right.
Great
Thanks so
information.
much.
Dr. Palafox, thanks for being
Thank
with
you.
us this morning.